Thank you for allowing us to take a few minutes of your time. We are representing the Rhode Island Senior Medicare Patrol Program. In today's presentation, we will talk to you about Medicare fraud and abuse, how they affect you, and how you can take charge to help prevent fraud and abuse in 3 easy steps. Protect, detect, and report. So now a few questions to ask yourself. So how many of you are Medicare beneficiaries? How many of you are caregivers? How many of you pay taxes? Now you might be wondering, why should I care about Medicare fraud? Well, Medicare fraud, errors, and abuse affect everyone. Each year, Medicare loses billions of taxpayer dollars to improper claims. This puts the Medicare Trust Fund at risk for everyone and affects the future of the Medicare program. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they result in higher Medicare premiums and waste money that could be used to increase and improve healthcare services. Medicare fraud, errors, and abuse can also cause serious personal consequences for beneficiaries, such as medical identity theft, negative health impacts, and personal financial losses. Medical identity theft occurs when a beneficiary's Medicare number is misused, either by a provider, a supplier, or by someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised. Medicare numbers are for life, even if stolen or misused. So a beneficiary whose number is compromised may be affected forever by false claims against his or her Medicare number. Health impact. Receiving health care from a fraudulent provider can mean the quality of the care is poor, the intervention is not medically necessary, or worse, the intervention is actually harmful. A beneficiary may later receive improper medical treatment from legitimate providers as a result of inaccurate medical records. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed Medicare benefits. Personal financial losses. Medicare numbers are as valuable as Social Security numbers to thieves who wish to set up credit card accounts with someone else's identity. So what is the Senior Medicare Patrol? The Senior Medicare Patrol is here to help you avoid these problems. Senior Medicare Patrol programs, or SMPs, help Medicare and Medicaid beneficiaries prevent, detect, and report healthcare fraud. By doing so, we help preserve the integrity of the Medicare and Medicaid programs. Because this work often requires face-to-face contact to be most effective, SMPs nationwide rely on approximately 5,000 volunteers who are active each year to help in this effort. Now that we've learned a little bit about Medicare, let's look at Medicare fraud. Medicare fraud involves intentionally billing Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. Next, what is Medicare abuse? Medicare abuse occurs when providers supply services or products that are not medically necessary or that do not meet professional standards. Medicare fraud and abuse are very similar and many times overlap. Here are some examples of fraud and abuse. Billing for services, supplies, or equipment that were not provided. Billing for excessive medical supplies. Obtaining or giving Medicare number for free services. You should treat any offer of free services in exchange for your Medicare or healthcare identification number with caution. Improper coding to obtain a higher payment. Unneeded or excessive x-rays and lab tests. Claims for services that are not medically necessary. Using another person's Medicare number or letting someone else use your number to obtain medical care, supplies, or equipment. So what can you do to take charge and help prevent Medicare fraud, errors, and abuse? I'm here to tell you how in 3 easy steps you can do that. Protect, detect, and report. First, protect yourself and your loved ones from Medicare fraud and abuse. Do treat your Medicare and Social Security cards and numbers like your credit card. Don't give out your Medicare number except to your doctor or other Medicare provider. Don't carry your Medicare card unless you will need it. Only take it to doctor's appointments, visits to your hospital or clinic, or trips to the pharmacy. Do be aware that Medicare doesn't call or visit to sell you anything. However, Medicare does now require the contractors to contact beneficiaries from time to time, so make sure to be vigilant. Keep in mind that you don't have to talk to anyone who calls you or shows up at your door who you do not trust. Medicare contractors will understand. Do be cautious of offers for free medical services. If it sounds too good to be true, it probably is. Do pass it on. Share this information with friends and family members who might not already know how to prevent Medicare fraud and abuse. Second, detect Medicare fraud and abuse. Even when you do everything right, there is a chance that you could be a target of healthcare fraud. There are many ways that your personal information can be used without your permission. Record doctor visits, tests, and procedures in your personal healthcare journal or calendar. Always review your Medicare summary notice and explanation of benefits for mistakes. Look for 3 things on your billing statements. 1. Charges for something you didn't receive. 2. Billing for the same thing twice. And 3. Services that were not ordered by your doctor. Compare your Medicare summary notices and other statements to your personal healthcare journal and prescription drug receipts to make sure they are correct. Access to your current Medicare account is available 24 hours a day at www.mymedicare.gov. You can also look to these handouts if you have them available, the MSN fact sheet and personal healthcare journal. Third, if you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims and help to save your Medicare benefits. To report your concerns, first, if you have questions about information on your Medicare Summary Notice, or MSN, or Explanation of Benefits, or EOB, call your provider or plan to find out if it was an error that they can correct without taking any further action. If you are not satisfied with the response you get or are not comfortable calling your provider or plan, gather all of the facts that you can about your situation. Make sure you have your MSN or EOB and any other supporting documentation that shows the possible fraud or abuse. Then, contact your SMP if you need help. Please keep in mind that services provided by your SMP are free and confidential. If you need to reach us at the Rhode Island SMP, please visit us online or call us. Our contact information is provided on the screen and/or in the handouts. Thank you for your time, and please be vigilant.